It has confirmed 74 new cases of coronavirus in the state. Governor Umar Ganduje made this known on Saturday. Speaking at a press briefing, Ganduje said out of 489 samples, 74 tested positive. We have taken samples of 489 people. Out of those numbers, 74 were confirmed positive for the virus. Now moving on to Lagos State. The governor of Lagos State, Babajide Sanwo-Olu, has admitted they might resort to mass burial as a way to decongest crowded mortuaries in the state. Sanwo-Olu, while giving an update on the COVID-19 pandemic on Saturday, explained that mortuaries are congested as a result of the lockdown. However, he made it clear that the deaths were not those of victims of the pandemic. Aside from the lockdown, Sanwo-Olu also linked the mortuaries congestions to the recent Lenten period, during which many Christian bodies forbid burying their loved ones because of this inability to hold funerals occasioned by the restrictions of movement. At mortuaries in Lagos, we are now getting to the peak, and there is a need for us to have a decongestion. Alright, let's quickly join the governor of Lagos State, Babajide Sanwo-Olu. I'll be right back, don't go anywhere.
Still on the matter of essential movement, I would like to speak concerning funerals. One of the outcomes of the lockdown is that many families and households have had to postpone funeral plans for their loved ones who have passed away before or during this period. As you may all be aware, many Christian denominations do not carry out funerals during the Lenten season. Funerals are typically kept on hold during this period and scheduled for the period immediately following the end of the Lent. Unfortunately, this year, the COVID-19 lockdown coincided with the end of the Lent season, which caused many families and households to further suspend or put off their funeral plans. Because of this inability to hold funerals occasioned by the restriction on movement, our mortuaries in Lagos State are now getting to the peak, and there's a need for us to have a decongestion. Let me make it clear that these are not COVID-19 deaths in any form. And I urge gentlemen of the media to report this accordingly. Mortuaries are getting filled up not because of COVID-19. In Lagos, we have not recorded more than 18 cases to date, so it certainly cannot be because of COVID-19. The only reason the mortuaries are getting filled up is because funerals have not been held in the last 2 months or thereabouts. I'm also now constrained to make this appeal to all Lagosians who have corpses of their loved ones in our mortuaries to please go ahead and schedule these funerals. Let me now make it clear that funerals are on the list of activities exempted from the lockdown restriction. You can hold or attend your funeral ceremony in Lagos State as long as you comply with the requirements that we have laid down. And for emphasis, I will reiterate them again. That we do not have persons at any funeral, including the officiating religious leaders, not exceeding 20. Physical distancing must be maintained at all funeral ceremony. All attendees or mourners must wear a face mask and must ensure that they wash their hands before or after the ceremony. There must not be any form of parties or reception that will accompany these funeral ceremonies. And be rest assured that as long as you keep to these directives and you fully comply with them, funerals will be allowed and will be encouraged to take place immediately. If we are unable to see a decongestion of the mortuaries across the state within the next 2 weeks, Lagos State government will now be compelled to seek to have a mass burial, and we don't want to force this on anybody. which is why we're asking for the cooperation of all of us. This is not a time where you need to wait for your brother or your sister or your sibling who is 10,000 kilometers or 6,000 kilometers away from here for them to come back before you can have the funeral. These are very difficult times, and I imagine that families and relatives and siblings will understand that we need to have this and we need to put this behind us. So we're reiterating it again that we'll give a 2 weeks window and we'll expect a lot of people to comply, after which the state government might have to take other directives and take other decisions in that manner.
Alright, welcome back. Still on COVID-19 updates. Now moving on to Kano State. Governor Ganduje asks Buhari for urgent help. The governor of Kano State, Abdullahi Ganduje, has appealed to the President Muhammadu Buhari government to take urgent steps to reactivate the Nigerian Center for Disease Control (NCDC) COVID-19 testing center at the Aminu Kano Teaching Hospital. Ganduje made the appeal during a press briefing held at the government house. The governor, who described the situation as serious, stated that more isolation centers were also needed in the state. I'm taking you back to Lagos State. The Lagos State Governor Babajide Sanwo-Olu on Saturday announced that the compulsory use of face masks by residents from Monday, April 27th, as part of measures to stem the spread of COVID-19 pandemic, which has continued to be on the rise in the state. Sanwo-Olu also disclosed other important measures taken by state, however announced the release of 209 prisoners from various prisons across the state. The governor, who made the remarks during a live broadcast on the update of COVID-19 situation in the state held at the State House, said the rise in the number of confirmed cases of the virus in the state indicated a fast spreading of community transmission.
Regarding the face mask, you know that I've touched on these issues a couple of times, but let me now formally also announce that face mask, like I did mention earlier in the week, will now become a compulsory thing that we must wear at any public gathering. We are currently producing millions of these face masks from our various tailoring companies, and it presents a great opportunity for businesses, for all these small, medium-scale businesses to contribute to COVID-19, and it's also a chance for them to make good of their businesses and to earn some money. So once we collect the first batch, which I think will be coming in tomorrow or next, we'll start distributing to our citizens free, but certainly cannot go around everyone. And so that's why I want to appeal to members of the organized private sector to please patronize first these local manufacturers and purchase these masks for distribution to your workers and staff immediately. And so if I can wear it and you also wear it, it will slow down the spread of this virus, and I think it will do all of us a great good.
Osun confirms 12 new cases of COVID-19, test 167 suspects. The Osun State government on Saturday announced that 12 out of the 167 suspects have been tested positive for the novel coronavirus pandemic. The State Commissioner for Health, Dr. Rafiu Isamutu, disclosed this in a statement, adding that the 12 new cases were recorded in Osogbo, the state capital, Ile-Ife, Ede, Ikire, and Ejibo. The commissioner said the fresh tests were conducted in the last 2 weeks of the lockdown, noting that the lockdown has proven effective in containing the spread of the virus. Isamutu, however, urged residents of the state not to panic as he implored them to continue to comply with the stay-at-home directive and also keep social distancing with strict observance of all precautionary measures to curb the spread of the disease in the state. He also emphasized that the ban on the public gatherings remains in force, just as he urged residents to take the wearing of face masks seriously, as it is now compulsory across the state. The Lagos State Traffic Management Authority last month has warned the residents of the state that deafening the COVID-19 lockdown order is embarking on suicide mission. The last man General Manager Olajide Oduyoye stated this in an interview with NAN on Saturday. He said it is very difficult to understand how we are trying to prevent people from killing themselves by violating the stay-at-home order, and some still do not understand the implications for them and their loved ones. On the 25th of April 2020, 87 new confirmed cases and 1 new death were recorded in Nigeria. One new state, Imo, has reported a confirmed case in the last 24 hours. Till date, 1,182 cases have been confirmed, 222 cases have been discharged, and 35 deaths have been recorded in 28 states and the Federal Capital Territory, Abuja. The 87 new cases are reported from 9 states: Lagos 33, Borno 18, Osun 12, Katsina 9, Kano 4, Ekiti 4, Edo 3, Bauchi 3, Imo 1. Now taking you through the states affected, number of cases confirmed, number of active cases, number of discharge, number of deaths, and also don't forget that one new state has joined the list. I'm talking of Imo State. And also, Lagos State has the highest total confirmed cases of coronavirus in Nigeria. Lagos State, number of cases confirmed in Lagos is 689, while the number of active cases in Lagos State is 548. Number of discharge in Lagos State is 122, while number of deaths in Lagos State is 19. Moving on to Abuja, FCT. 138 confirmed the cases in Abuja, while we have 100 active cases in Abuja and the 35 patients has been discharged. But we have 3 deaths in Abuja. Moving on to Kano State. 77 confirmed the cases in Kano State, while we still have 76 active cases in Kano. Not discharged, but we have 1 death in Kano State. 35 confirmed the cases in Ogun State. 29 active still in Ogun State, while 5 patients has been discharged, but 1 death. Moving on to Gombe State, 30 confirmed the cases in Gombe and also 30 active cases in Gombe. No discharge, no death in Gombe State. Moving on to Castina, we have 30 cases in Castina, while 25 active cases in Castina. Number of discharge is 4 in Castina State, with 1 death. Now in Osun, 32 confirmed the cases in Osun, 14 active cases. Number of discharge cases in Osun is 18, but no death according to NCDC. Moving on to Edo State. In Edo State, 22 confirmed the cases in Edo State, while we have 12 confirmed the cases in Edo. but 7 patients has been discharged, while we have 3 deaths in Edo State. Moving on to Borno, 30 confirmed the cases in Borno State, 28 active, not discharged, but with 2 deaths in the Borno State. And also in Oyo, we have 18 confirmed cases in Oyo, 12 active presently in Oyo State, and the number of discharge in Oyo State is 5, with 1 death in Oyo State. We have Akintola Oluwaseyi concerning the briefs about additional measures being taken by the Oyo State government to prevent the spread of COVID-19 in Oyo State. Akintola, let's have you before we join the governor himself, Seyi Makinde.
Good day, everyone. Thanks so much, the COVID-19 update team and Bridget Banks. I'm Akintola Oluwaseyi from Oyo State, giving the latest updates from Oyo State. The governor addressed the public yesterday after the meeting that was held with the Oyo State COVID-19 task force at Government House, Agodi, Ibadan. The government made it known that the state secretariats will reopen on Monday, 27, 2020, with the resumption of civil secretariats at level 13 upward, who has personal or separate office. And he added that there are some guidelines to be followed by this set of people within the secretariats. He said new security measures will take place, and there will be only one usage of gates, which will serve as entrance and exits, while other gates remain closed. He also added that all meetings will be held online, and no visitors are allowed except absolutely necessary. He also said there must be hand washing and hand sanitizing around the secretariat. He said a 100mm hand sanitizer and face mask will be given to each officers. And he also added that canteens around the secretariat will remain closed. He advised that all officers are encouraged to bring their own food for lunch. He also added that posters and banners will be in conspicuous places around the secretariat to revalidate guidelines for resumption. Another thing that was said during his address to the public, he said the dusk-to-dawn curfew in Oyo State will be relaxed from the initial 7 p.m. to 6 a.m. to 7 p.m. to 5 a.m. so as to accommodate farmers during these planting seasons. And the farmers have actually been taught on how to stay safe as they farm during this season, as they will farm during this period. Governor Seyi Makinde said that the 100 million face mask that has been produced will start its distribution by tomorrow. And this mask will be distributed for free to the marketsmen and women, artisans and civil servants. He also added that the COVID-19 compliance guidelines will be provided for markets, including hand washing and wearing of face mask. Only markets which meet up with these guidelines will be allowed to reopen. And he actually used the opportunity to commend the Minister of Health, Dr. Osage Enare, for the work being done at the national level to fight the COVID-19 pandemic. During his address yesterday, which was lastly said, he said the palliatives to be provided by the Oyo State government are now ready and will be distributed next week based on their data. They will be distributed to 90,000 households identified as the poorest of the poor and 30,000 target vulnerable households. So that was the address given by His Excellency Governor Seyi Makinde yesterday. It's Akintola Oluwaseyi for me. Thank you so much for having me on the show today.
Alright, thank you so much, Akintola Oluwaseyi from Oyo State. Now let's join the governor of Oyo State, Governor Seyi Makinde. We'll be right back, don't go anywhere.
We just finished the COVID-19 task force meeting, and here are some of the decisions taken from that meeting. The state secretariat will be reopened on Monday, April the 27th, 2020. Only civil servants at level 13 and above with separate offices will resume. And we've put certain guidelines in place to prevent and control the spread of COVID-19 within the State Secretariat. One, there will be new security measures in place, including having only one gate to serve as entrance and exit. All other gates will be closed. All meetings will be held online. No visitors are allowed except absolutely necessary. Also, 100 ml hand sanitizers and face masks will be given to each officer. Dusk to dawn curfew in Oyo State will also be relaxed. Currently, the curfew is from 7 p.m. to 6 a.m. From tonight, it will be from 7 p.m. to 5 a.m.
Welcome back. Now let's move on. Moving on to Kwara, we have 11 confirmed cases in Kwara State, 9 active presently in Kwara State, and 2 has been discharged with no death in Kwara State. Alright, we have one of our COVID-19 team online all the way from Kwara State, Onifade Ibukunoluwa. Okay, Ibukunoluwa, let's have you.
Thanks so much to COVID-19 update team and DG BAMS. I'm Onifade Ibukunoluwa reporting from Kwara State. Presently, as I speak to you, there is a sum total of 11 COVID-19 cases in Kwara State. 2 has been discharged, while we have 9 active cases undergoing treatment. So far, we haven't recorded any deaths. Earlier on Monday, 6th of April 2020, Kwara State government officially confirmed 2 coronavirus cases. This was contained in a press release by the State Technical Committee on Coronavirus. One of the patients is the wife of the UITH patient, a UK returning Muideen Jimoh Obanimumo, who was admitted into UITH on 1st of April and who was assessed to have had food poisoning, or not to the doctors and nurse that he was a victim of COVID-19. He was certified dead about 10:50 p.m. on the day of his admission and was packed and deposited in the UITH morgue around 12 midnight. As early as possible the following day, April 2nd, his corpse was given to his family for burial. After the death of Muideen Jimoh Obanimumo, his wife was tested and confirmed positive, while the other patient of COVID-19 was also a UK returning. Shortly after the state outbreak of 2 cases of COVID-19, the state governor Abdulrahman Abdulrazak, took a drastic measure to prevent the spread of this virus in the state by announcing a total lockdown, which took effect on April 8th by 6 p.m. The lockdown commenced at Offa before it was spread to all the local government areas of Kwara State. Staff of the UITH, both the doctors and nurse in charge when the patient was admitted, and people who come in contact with this UK returnee were asked to be in isolation for days, while the NCDC took 132 samples for tests. The result shows that 4 doctors and a nurse who were on duty that day were positive, while the other cases we have presently as Kwara State were those who come in contact with those who have these cases. Presently, Kwara State is on a total lockdown, while the citizens of the states were only permitted to go out on Mondays, Wednesdays, and Fridays to restock for the week between 8 a.m. to 12 p.m. As I speak to you, the governor of Kwara State has been trying his best to ensure adequate security and preventive measure in order to curb the spread of this virus. Also, the government have commenced the distribution of foodstuff to some local government areas in Kwara State, while the lockdown still continue in the state. That's all I have for today. Thanks so much, listener, for having me on the show today. Once again, I'm Onifade Ibukunoluwa reporting from Kwara State.
Alright, thank you, Onifade Ibukunoluwa from Kwara State. Let's continue. I'm moving on to Akwa Ibom. 11 confirmed cases in Akwa Ibom State, while there's still 4 active cases in Akwa Ibom, but 6 has been discharged with 1 death in Akwa Ibom State. In Bauchi, 11 confirmed cases in Bauchi, with 6 active cases presently in Bauchi State. 5 patients has been discharged, no death in Bauchi. Moving on to Kaduna State, 10 confirmed cases in Kaduna, while we still have 6 active cases in Kaduna State. 4 has been discharged with no death in Kaduna State. Now in Ekiti. Now let's join Esonfemi all the way from Ekiti State. Esonfemi, let's have you.
A very big thanks to the COVID-19 updates team and DJ Baswan. Building on the previous reports, Ekiti State has again recorded another 4 new COVID-19 positive cases. This was contained in a report filed to the state government by the Nigeria Center for Disease Control (NCDC) yesterday, Saturday, 25th of April 2020. The new cases are primary contacts of the 4th recorded case, a 45-year-old doctor who carried out a surgery on the recently deceased 3rd positive case during childbirth. It would be recalled that earlier this month, Ekiti State recorded its 3rd COVID-19 case, an health worker from Lagos who sneaked into the state and claimed to enjoy the state's free health care service. However, the newly confirmed cases are currently stable and with no symptoms, and they have been transferred to the state's isolation center in Ado-Ekiti, while the state's contact tracing team have commenced another process of contact identification and tracing of their immediate contacts for isolation. This brings the total number of COVID-19 positive cases in Ekiti State to 8, 5 active, 2 discharged, and 1 death. Esonfemi Williams reporting from Ekiti State.
Thank you so much, Esonfemi from Ekiti State. Ekiti has added another 4 cases, making it Ekiti has 8 confirmed cases in Ekiti, and while we have 5 active cases in Ekiti State, 2 has been discharged with 1 death in Ekiti State. Now to Delta State. In Delta State, 6 confirmed cases in Delta State, while we still have 5 active cases in Delta State. No discharge patients yet in Delta State. No discharge, but with 1 death in Delta State. And also in Ondo State, we have 4 confirmed cases in Ondo State. 2 active presently in Ondo State, while 2 patients has been discharged in Ondo State, but there is no death in Ondo State. Now moving on to River State, we have 3 confirmed cases in River State. No active, 2 has been discharged, but we have 1 death in River State. 3 confirmed, no active, 2 has been discharged with 1 death in River State. Now to Abia State, we have 2 confirmed cases in Abia State. 2 active presently in Abia State, no discharge, no death in Abia State. Moving on to Enugu State, we have 2 confirmed cases in Enugu. No active, the 2 has been discharged with no death. Now moving on to Niger State, 2 confirmed, 2 active, no discharge, and no death in Niger State. And in Jigawa State, 2 confirmed cases in Jigawa. And also we still have 2 active presently in Jigawa State. No discharge patients, no death in Jigawa State. In Sokoto, we have 2 confirmed cases in Sokoto State, 2 active, no discharge, no death in Sokoto State. In Zamfara, we have 2 confirmed cases in Zamfara State, and presently we still have 2 active cases in Zamfara State. No discharge patients in Zamfara State and no death. Moving on to Benue State, 1 confirmed case in Benue State, 1 active, no discharge patient and no death in Benue State. Now moving on to Anambra State, 1 confirmed case in Anambra State. Presently, there is no active case in Anambra State. Confirmed the case in Anambra has been discharged and no death in Anambra State. And to Adamawa, we have 1 confirmed case in Adamawa State, 1 active, no discharge, no death in Adamawa State. Plateau State, we have 1 confirmed, 1 active, no discharge, no death. These also apply to Imo State. 1 confirmed case in Imo State and 1 active presently in Imo State. No discharged patients yet and no death in Imo State. This now brings the total confirmed cases in Nigeria to 1,182 and the total active cases in Nigeria to 925. This now brings the total discharged patients in Nigeria to 222 in Nigeria, while we have 35 deaths in Nigeria. And also don't forget that Lagos State has the highest cases of coronavirus in Nigeria, while Abuja FCT takes the 2nd position. Alright, this is where I will drop the curtain on today's COVID-19 update, coming to you from the service of Teamsed 94.1 FM. Thanks to all the Teamsed FM COVID-19 update team, both in Nigeria and in abroad over there. I say very big thanks to you. My name is Joseph Frederick Oluwabas One. Let's meet again tomorrow for another fresh COVID-19 update on this Super Die radio station, Teamsed 94.1 FM. Remember to wash your hand frequently. See you tomorrow. We'll meet again. Stay at home. Stay safe. Stay updated. Bye for now.